This video has been produced by the Community Learning Disability team. In the video, we will talk to you about the services we offer and how to access support.
The Community Learning Disability team is a health service based in Sheffield. We work with people who live in Sheffield, are aged between 18 and 65 years old, have a diagnosis of a learning disability, and have a health need which cannot be met by other services such as a GP, a hospital, or other health teams.
We work with people who have a learning disability. By learning disability, we mean the person's intellectual functioning is severely impaired. This is the person's ability to process information and solve problems. The person's social adaptive functioning is severely impaired. This is the person's ability to do everyday tasks independently and keep themselves safe. The person needs to have been experiencing both of these things since before the age of 18. When we see someone for the first time, we assess if they are eligible for our service. This means finding out if the person meets our criteria for learning disability. This usually involves a face-to-face screening. Further assessment may also be required. If you are not sure if you or a person you care for has a learning disability, we recommend that you speak to one of our referral coordinators. We will explain how to make a referral later in this video.
The Community Learning Disability team is a multidisciplinary team made up of specialist health professionals. In our team, there are nurses, psychologists, occupational therapists, speech and language therapists, physiotherapists, psychiatrists, and referral coordinators. We work together to help people with learning disabilities, their families, and carers in a person-centred way.
Our learning disability nurses help people with looking after physical and mental health, sexual health, relationships and sex education, coping with loss and bereavement, blood tests and desensitisation before medical procedures, and getting the right care from the doctor or hospital.
Our clinical psychologists do direct work with people with learning disabilities and indirect work with families and carers. Direct work with a person may involve one-to-one therapy for anxiety, depression, anger or trauma, group sessions around coping with stress and keeping safe, and specialist assessments such as psychometric and mental health assessments. Work with carers may involve using positive behaviour support to understand and respond to challenging behaviour, partnership work with families and carers, and workshops and consultation with staff and care providers.
Our occupational therapists provide support with assessing the skills and abilities a person with a learning disability already has, helping people develop their daily living skills in a safe and supportive way. Shopping, managing finances and cooking are some examples of this. They support people to find and engage in meaningful activities. Occupational therapists can help with looking at equipment and changes to the environment that help a person with an activity. They can also help with assessing a person's sensory needs and making changes that help them get their needs met and cope with the demands of everyday life.
Our speech and language therapists help people with learning disabilities and their carers with communication. This may include assessment of communication skills and levels of understanding, direct and indirect therapy work to help the person communicate, advice on alternative methods of communication, and communication training and workshops. Speech and language therapy also lead our dysphagia pathway. Dysphagia is where a person has difficulties eating, drinking, or swallowing. A service user may be referred because they have been coughing or choking at meal times, appear to be in discomfort after eating or drinking, or have lots of chest infections. If there are concerns about a person's swallow, the team assess their eating and drinking, and following an assessment, guidance is provided around eating and drinking aids and consistency of food and fluids.
Our physiotherapists help people with mobility assessments and prevention and management of falls, posture management and positioning, including support with seating, wheelchairs and sleep posture. They help create individualised exercise plans, including hydrotherapy and rebound therapy. They provide specialist moving and handling assessments and advice. Our physiotherapists also help with supporting people to access mainstream services. This includes wheelchairs, orthotics, falls, spasticity management, and managing musculoskeletal pain.
Our consultant psychiatrists and specialist nurses support people with the assessment and treatment of mental health problems. Where appropriate, they prescribe medication which is reviewed regularly with the person and their carers. Medication is prescribed in line with NICE guidance and the STOMP-LD initiative, which aims to prevent the over-medication of people with learning disabilities. Psychiatry work closely with GPs and other health professionals to ensure people with learning disabilities are receiving the right care and treatment.
There are also joint pathways in the community learning disability team. These are coordinated by clinicians with special interest in these areas. Some people with a learning disability also have autism. Autism is a lifelong developmental disability that affects how a person communicates with and relates to other people, and how they experience the world around them. We offer assessment for people with a learning disability who want to find out if they also have autism. We provide information about autism for the person and their family following diagnosis. We also offer autism workshops and training for carers and support agencies. Many people with autism do not have a learning disability. If you do not have a learning disability, but live in Sheffield and would like to find out if you have autism, you should contact the Sheffield Adult Autism and Neurodevelopmental Service, SANS, on 0114 271 6964.
People with learning disabilities are significantly more likely to develop dementia than people in the general population. Dementia is a progressive disease which affects memory, thinking, and daily living skills. We offer dementia screening and assessment when a person with a learning disability has had a change in their memory, behaviour, or skills. We also offer proactive assessments for people who are at a greater risk of developing dementia, such as people with Down syndrome. By assessing someone's skills earlier in life, we create a baseline which we can use if dementia is queried in the future. When someone with a learning disability is diagnosed with dementia, we help the person and their carers understand the diagnosis. We explore the person's needs and think about what we can do to make sure the person has a good quality of life. We also provide training in how to support someone with dementia.
Many people with learning disabilities need extra support to keep them safe. Sometimes this support requires us to find a balance between the person's rights and their safety. For example, a person who uses a wheelchair may need a lap strap to stop them falling. The lap strap keeps them safe, but it also stops them from getting out of the chair whenever they would like. Our Alternatives to Restraint pathway helps ensure that any restraints used are safe and are carried out in the least restrictive way. We work together with the person and their carers using the principles of the Mental Capacity Act. When we talk about restraints, we refer to things like lap straps on wheelchairs, bed rails, bed sensors and alarms, locked doors or drawers.
We link with the Children and Adolescent Mental Health Services, or CAMS, occupational therapy and physiotherapy at the Sheffield Children's Hospital, and the Learning Disability Transitions Nurse within the Sheffield Teaching Hospitals NHS Trust. These services identify young people with learning disabilities who may need support from the Adult Community Learning Disability team. If the person and their carers want support, we offer them a clinic appointment. The purpose of the clinic is to gather information about the person's health needs and to make referrals within the health team as required. We can also signpost the young person to other services via referrals if needed. Not every child with a learning disability is identified as needing support to transition to adult services. If you or someone you care for has a learning disability and would like support, please contact the Community Learning Disability team.
Please be aware of the services that we do not offer. We are unable to offer diagnostic-only assessments. We will only assess someone's eligibility for our service if they have a health need which would best be met by a specialist learning disability service. This means that we are unable to assess someone who would like to find out if they have a learning disability but does not need any health support. If you have a health need which would best be met by your GP or another health service, we recommend that you access support from them. We do not have social workers in our team and are unable to help with things like support packages, housing, safeguarding, or adaptations to your home. We work closely with Adult Social Care in Sheffield, who can help with these things, and we would be happy to help you get in touch with them.
We are also unfortunately unable to support you with applications for benefits or bus passes. We recommend that you speak to the Job Centre or Citizens Advice about this. We do not offer vision and hearing tests directly, however we can help you get in touch with services that offer accessible vision and hearing tests for people with learning disabilities.
If you or someone you care for has a health need which would best be met by the Community Learning Disability team, please make a referral. We accept referrals from professionals and self-referrals from the person and the carers. If you are referring someone else, please discuss the referral with them first. We need the person's consent to work with them. If the person does not have capacity to consent to the referral, you should be confident that the referral is in their best interests. Where possible, we advise that you speak to a referral coordinator before making a referral. Call us on 0114 226 1562 or email us at cldtbusinesssupport@shsc.nhs.uk. We will send you a referral form to complete. We aim to screen the person's referral within 4 weeks and see them within 18 weeks.
If you or someone you care for require urgent mental health support or advice, you can contact the 24-hour mental health teams on 0114 226 3636.